Hello, my name is Kelechi Okpara. I was at Somerset Hospital in Cape Town doing internal medicine, and I am going into the internal medicine specialty.
My name is Alex Vesling. I did my clinical rotation at New Somerset Hospital in Cape Town, and I was doing it in the pediatrics department.
My name is Lauren Textor, and I rotated in psychiatry at Somerset Hospital in Cape Town, South Africa. Some of the unique features of training at Somerset Hospital in Cape Town is that it's a public safety net hospital in an urban city center. So you get to see kind of a lot of diversity of pathology and psychiatry that you wouldn't see elsewhere, and that's super, super different from the kinds of patients that you would see in the US in a psychiatric setting.
So I specifically chose Somerset Hospital at Cape Town because my goal as a physician is to work with underserved patients. Going into Cape Town and doing this rotation and working with such wonderful people just reinforced my desire to work with underserved patients.
The wards there are set up a little differently than here in terms of there it's one big kind of giant room with then just a bunch of cribs and beds lining the outside. So it's a very busy ward and a lot of noise, a lot of commotion. So when we would do blood draws or things like that, we'd bring the patients over to the treatment room. And so that first patient that I was kind of bringing to the treatment room, I was asking the registrars, why they go to the treatment room for a blood draw. Is it just because of how busy the ward is and for the other patients? And they brought up the fact that, a lot of these patients are already come from kind of difficult home situations, a lot of things that they're dealing with, poverty and dealing with a lot of parents with HIV or parents that they've lost or just difficult home situations, and they come to the hospital and their bed is their safe space, and so they take them to the treatment room to avoid kind of re-traumatizing them or traumatizing them in what's supposed to be their safe space area. And I think, going into pediatrics, just sort of that mindset of that bed being that kid's safe space.
There was a building at the hospital that had been shut down but used to act as nurses' housing. And since 2017, it had been occupied by a woman who lost her own housing nearby, and she actually moved into the building, tore down the kind of boarded up windows, and just started hiding there. And she allowed me into the building, and I was able to take a tour and some photographs of the squatters' encampment. And because she was so organized and really understood the politics of housing in Cape Town, she was able to organize several hundred other people who are now also living there with her, kind of demanding that the government take responsibility for the lack of housing in the city and in the area. So that was super inspiring for me and taught me a lot about just how people can build movements in a city as big as Cape Town, in a place that has so much inequality.
We often talk about social determinants of health here, but sometimes it feels like it could be a bit more of an academic exercise than really imagining what that lived experience is like for the patient, and just seeing so many of my attendings really put themselves in the patient's shoes or the parent's shoes and the emotions that are associated with coming to the hospital, with having a sick child, the extra stresses that puts on their life, and really just thinking about what that family was going through before they walked in. I think just kind of that ability to step into the lived experience was something that was really inspiring to me, and something that hoping to kind of continue to incorporate into my practice moving forward as I start residency.
I just really think Cape Town is an inspiring city in so many ways, specifically for people in the US to understand inequality, power, racism that acts at the interpersonal and structural levels. I think it's just highly, highly educational.
There's just a lot of similarities between sort of the ecosystem here in Los Angeles and the ecosystem in Cape Town, in that there's a lot of wealth right there in the city, but then you leave even 10 minutes outside the city and you hit extreme poverty. And so I think, having trained in an environment where we have the riches of the rich a couple miles from, homeless encounters here in Los Angeles, I think it's really interesting to get to go to another place that has similar vast differences in the socioeconomic status of the people you're interacting with, the patients that you have, and able to see what another system does in those situations.
Oftentimes, I think in medicine, it's so easy to see the patient first and not realize that there's a human behind that patient. But as a physician, as a future physician, my goal is to really practice medicine and make sure, I see the human inside the patient, practice medicine with humility.
I want to thank the David Geffen School of Medicine at UCLA and the Global Health Department specifically for their support and for allowing us to have these experiences. The Global Health Department here was a major reason for me choosing DGSOM as a place to study. And so the opportunity to end my medical career on a global health elective is just more than I could have asked for. So just very thankful for everyone here and the support of the global health department.